Hello, everybody. Can you hear me?
Yep,
I
hello.
can.
Good. So I would like, when I do start the meeting, I will, after I call to order, I'll read the waiver, and I would like to ask for a minute of silence for Jim Bush, and before we start the formal part of the meeting.
Also, David, before you start, I want to make sure that everybody that is trying to access the meeting is able to access the meeting, okay? I don't
do
know who
have
has
that.
the ability to control that.
So I do have that on one of my virtual. This is a virtual meeting. Does anyone have concerns about access to this meeting? I plan to ask that question, but of course, if they don't have access, they can't answer it. But hopefully we can find out. I mean, I would like to hope that people could call or email us, but
Yeah. Well, I'm hoping, and there's also a chat function, and I'm just, maybe Peter might keep a lookout as well, just to be sure that we're not denying access to anybody unintentionally.
yes, exactly.
So there's somebody's on the phone. I need a name for the record for attendance. Last, it's 3970.
I just joined. My name is Charles Meek. If that's, I don't know if that's my number or not, but
Okay. Thank you.
you're welcome.
And then I have Kathy Foster and Kathy Marin. Is that correct?
Yes.
Okay, I have 4 o'clock. I would like to call this Board of Health meeting to order at 4 p.m. on September 16th, 2020. I will start with reading our notice on recording and waiver for having a remote meeting. And Pete, I would just like to, I see you are recording, so thank you. So pursuant to Governor Baker's March 12, 2020 order sustaining certain provisions of the open meeting law, general law, chapter 30A, section 18, and the governor's March 15 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Town of Adams Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. Remotely attending are members Dr. Peter Hoyt, Dr. Laura Grandchamp, and myself, Dr. David B. Rhodes, attending from town, and I am attending from home. I do not yet see Mark Blaisdell, our code enforcement officer. He did say he was going to make it. We have posted today's agenda, which included the call-in information for today's meeting. Despite our best efforts, if we are not able to provide for real-time access for the public to participate in today's meeting, a recording of this meeting will be made available. We are participating remotely. Please note that all votes taken during this meeting will be by a roll call vote. I will state the Board of Health member's name and ask for their vote for each vote necessary. And As noted, Pete Hoyt will like to make sure he has everyone's name who is attending, particularly those who only call in with phone number. As I noted, the meeting is being recorded. Pete is recording it for the town of Adams. I believe that Jack Garino is recording this. He said he always records the meeting. Is anyone else recording this meeting? Okay, having said it's, we have 2 recorders going. Before we start the formal part of the meeting, I would like to ask for a moment of silence in memory of Jim Bush. He will be missed. Thank you very much. As Attorney St. John noted, I should put out one final plea. If anyone is unable, do we have any indication that anyone is unable to access this meeting being carried out totally virtually?
So I
Not hearing any.
David, I see we have 8 participants and nobody's in the waiting room.
Thank you. And I do note that Ms. Foster is here. I would like at this point just to thank you for attending. And I want to emphasize that we will be taking your complaint seriously in today's meeting. We can only acknowledge the receipt of the complaint and plan how to respond to you under appropriate rules and procedures. If you wish to speak today, you will have a chance during public comment, but if you do, I just ask you to please be brief and stick to and avoid any arguments. So thank you very much. And I do see that Mark Blaisdell is not in attendance yet.
He's in the waiting room right now.
Okay, good. Thank you. So first order of business is the approval of minutes. Pam has circulated the minutes from the April 5th, August 5th short meeting. Have you had a chance to review them?
Yes, I guess I have a question. Was that an official meeting? So would there be official minutes for this?
That is a good question, but I believe we did meet. We opened the meeting and we adjourned. So
Okay.
I do feel, and it does actually document the fact that there was an error. So I do take that as an official meeting that we should document. And
You as well.
Okay.
do I have a motion to approve the minutes?
Motion to approve.
Is there a second? Any further discussion?
No.
So how vote you? Pete,
Yes.
Laura,
Yes.
Dave, yes. The minutes are approved unanimously. Thank you. So I would now like to move on to administrative issues. I placed this on the agenda because I felt we needed to discuss. So for the following 3 agenda items, I would specifically like to invite Attorney St. John to interrupt if I say anything inaccurate or if you feel as though you need to expand. I'm mostly reading this because I tried to script it. So for the tobacco sales regulations, the first item under this, these are currently on hold. That's the status. The next steps would be for us to sign the regulations as revised on August 19th, and then forward them to the town clerk for further action, like he's sending to the AG's office and so forth. Concurrently, we would prepare an announcement for publication in the Eagle. However, Attorney St. John requested that I suspend further action because if I did so, an individual might come forward with a complaint that we violated open meeting law at that August 19th meeting. Attorney St. John's solution was to repeat the public hearing tonight. However, I had balked, arguing that I could not decide based on such limited information. Basically speculation, and well, it's just one person saying that there might be a violation. Nonetheless, I did not move forward with the regulation, but stated that I would have to bring the matter to the board at our next public meeting. So here we are. Do either of you have any questions at this point?
I don't have questions, but I do have some concerns. I do think that a major purpose of a public hearing is to make sure that we hear public comment before we decide something. And there is the potential that that didn't happen for everybody at the last meeting because of lack of somebody at town hall. So if we, I'm concerned that that wasn't achieved. Also, I'm concerned that there may be a future enforceability problem with the regulations if we adopt them from a meeting that had a open meeting law violation.
I totally agree with you. If I could go on to the next item, I think maybe it will clarify that to some degree. So in advising me to repeat the hearing, Attorney St. John indicated that he would have to uphold the complaint. So he knows the complaint, I don't. As such, he asked that I repeat that hearing tonight. Part of his rationale in doing so would be that this tonight's meeting occurs within the 30-day window for which a complaint must be filed. So if it's not filed by, I believe, Friday the 18th, or maybe the day after, depending on how you count, there would be no opportunity for an individual to file a complaint. From my understanding of the open meeting law, for the complaint to be valid, it must be signed and submitted to me to distribute to the board so that we can address it, at which point we would have a 20-day window in which to either redress or rebut. So for instance, if we did have an open meeting law violation that we could correct administratively, then it wouldn't go away, but it would be a valid solution. Or we could just say, argue that the complaint has no merit. In any case, we would file our decision to the AG's office for a determination. And so I think you understand basically that timeline. The timing starts, well, the first timing starts with our previous meeting, and then addressing the complaint starts with when that complaint occurs. We have not had a complaint, and there are 4 more days left. So, so right now, I see 3 options, and I would like to open it up to what you two think. We could just repeat the hearing, say at our next meeting, we will repeat the hearing. As such, we would have to change the effective date of the regulations. Second, We could just move forward with the regulations. If an open meeting law complaint is filed, we could address it on its merits. And if it's meritorious, we could repeat the public hearing and vote later. Thirdly, we could wait until after the 30-day window, i.e., I think I said Friday, it's either Friday or Saturday, to proceed. Again, if an open meeting law complaint is lodged, we could deal with it based on its merits. So again, what do you think? Are there any other options that we should consider?
Did I provide you some input, David?
Yes.
You know, one of the things about dealing with open meeting law complaints is that, you know, if there's an issue, it's preferable to deal with it in-house, so to speak, as you're trying to deal with it now, rather than wait for somebody to file a formal complaint and then deal with the Attorney General's office with regard to what may or may not have taken place. Now, I'm aware that there's the potential of a complaint being filed. In fact, I'm pretty sure it will be filed in a timely manner unless the board takes certain action, which I hope would include simply re-noticing and having another hearing on the regulations and basically doing it right under the open meeting law. Laura makes a very valid point to me, and that is that you know, when you have a public hearing and you deny access inadvertently, unintentionally, but you deny access to somebody, it seems to invalidate what takes place. And what I'm very concerned about is that if these regulations are someday challenged, irrespective of if the 30 days come and go and nobody files an open meeting law complaint, I think there may be a basis for challenging the regulations because of a defect in the process in enacting the regulations. So what I'm recommending, what I recommended to you before, is to renotice the hearing, you know, basically do it right. I know we have a lot of challenges in dealing with this in a remote fashion. It seems like you have a good handle on it tonight, and simply do it again. I don't think there's any harm in doing it that way. I had suggested putting it on for tonight, but I understand that there may be challenges in terms of giving proper notice. But perhaps at your meeting in October, consider doing that. That way, let's put this to rest, and let's not have to worry about whether someday somebody's going to be challenging the $1,000 fine or what have you, or some aspect of the regulation because of the concerns about the way the process was done. So that's my input on it.
I do not like making decisions without information. And so I really don't feel as though I can impose on a number of people to re-testify, although they have expressed willingness to do so, unless I had solid evidence. And not that I don't trust you, I do, but this is kind of an issue. It's like I have evidence against you, but you can't see it. You just have to plead guilty, and I you know, I just cannot see.
Well, let me put it this way. There was evidence, and if you look at the recording, there's evidence that people were denied access to the meeting. That was one problem under the open meeting law. Would you agree with me on that? The second problem is that the meeting was noticed to take place in town hall. Nobody was in town hall to conduct the meeting. Would you agree that there's a problem with that? Those are the issues that are being raised with me.
Did anyone come to town hall?
No,
And we
you know,
did
nobody is allowed there, but if you put in the meeting notice, David, that there's going to be a meeting at town hall and nobody is there to deal with it at town hall, let's say that somebody within town hall wanted to be at the meeting. There are certain meetings, for example, the Board of Selectmen meeting takes place as a hybrid meeting. Some people are situated in the selectmen's room, some people are situated remotely. But that's the nature of that particular notice. So there were two issues that I saw. One was the defect in the notice. The other was an issue about access to the meeting, which appeared to be an issue that I learned was going on at the time. People are trying to call in, couldn't call in. So, you know,
But
these
they
are the
did-
problems
was
that we're
anyone-
facing. Pardon me?
Was anyone, I mean, we did get callers that came through, and I know that the issue is with Zoom, that there have been a number of glitches that have caused that.
Mhm.
And so in the one, yes, so because it was a public hearing, it kind of ramps it up in terms of access. If it's just a public meeting, providing minutes afterwards is sufficient remedy. But I think what you're saying is because it was a public hearing, the need to assure access is greater than for a public meeting. Am I
Well,
correct?
I believe that they're equal. I think that if the public wants to access, say, a meeting, just an ordinary meeting of the Board of Health or an ordinary meeting of the Board of Selectmen, they have a right to access it. I know that there are issues with accessing meetings on Zoom. People all the time have difficulty. The governor's executive order provided a process by which you're supposed to recess the meeting until all those issues are clarified. And, you know, we're all novices at this, you know, so it's not, I'm not trying to fault anybody for doing anything, but I don't want this to come back. To me, the easy way to deal with this and the way that's going to secure the integrity, if you will, of these tobacco regulations is to make sure that you have the hearing. Everybody has equal access to the hearing, whether it be by Zoom or a hybrid or even an in-person meeting. And then, you know, get it done and get it over with and have that behind you so that none of us has to worry about, is there going to be a challenge because somebody said they were denied access at some point, or the meeting was defectively noticed because we were told to come to town hall, nobody could get into town hall. Those are the issues. So that's why I'm recommending it the way I recommend. I don't see it. I realize it imposes a burden on someone to advertise this, to re-advertise it and do it over. But I'd rather deal with that burden than the burden of having a regulation tossed out because of some invalidity in the process in which it was enacted.
May I have a motion? Laura, can you formulate a motion to?
Yes, I would move to rehold the public hearing and start from the beginning.
Second.
Any further discussion on this?
I just want to say that I don't have access to get into town hall. I don't have a key there that's locked, it's closed. So, I mean, that's even an issue as well with the postings. I also think that maybe we should have, as far as the town, should have a template for agendas for posting so that we don't make this mistake again. And also, David, if we can request a staff member to help us through this stuff, because, you know, technology and myself don't get along, and I'm running the Zoom meeting, which is dangerous. So, you know, we're doing this all by ourselves. We haven't had a staff member since March. So can you talk to Jerry or Jay or somebody to get us some help? And then hopefully we can avoid these open meeting law problems.
I totally agree.
And I would
with
suggest
you.
that we
I
don't
mean,
even meet anymore until we get a staff member.
Yes, I have been told that, yes, we seem not to be getting the assistance that we need. And in
I mean,
fact,
it's also, it's nice to see Mark here. We haven't seen him in a while, so I'm glad he's here, but we need staff, we need help.
Point,
That's all. Sorry.
yeah, that's a lot. So point well taken. Any more discussion? So then I will call for a vote on Laura's motion that we rehold the public hearing. We will talk about when, as soon as we finish this. So, Pete,
Yes.
Laura,
Yes.
and I will agree with the majority and say yes. So the motion passed unanimously. We will rehold the hearing. So, question. When do we rehold the hearing? We could, because I will be asking later on to have a meeting on the complaint from Ms. Foster in 2 weeks on September 30th. I would like to see that the hearing be held, the public hearing on the tobacco regulations also be held on the same night. Would that be?
I may have a problem if we have it at 4 p.m. I probably need to have it later, like 4:30 or 5.
I think 4:30 or 5 would be. So Mark is raising his hand. So we do not need to meet at 4. We could meet later. What does Mark have to say?
I was just wondering what the complaint from Ms. Foster was referring to.
She would like.
David, please, right now, as far as dealing with the complaint,
Yes.
we're only supposed to be discussing the fact that it was filed and that it's going to be referred to me for answer. It's an action filed in the Berkshire Superior Court. And the discussion regarding the merits of the complaint or the contents of the complaint can be discussed on September 30th in order to comply with the posting requirements and notice requirements under the open meeting law. Okay?
Yes, perfect. Thank you. So even.
Mark, if you want to talk to me about it, I'm happy to talk about it afterwards by phone call if you want.
Okay, no, I was just following the agenda. So that is what is referenced under the new business?
Yes, we will schedule a public hearing
Okay.
pursuant to the complaint. And so my question was whether to hold both of those together at the same time. It might be somewhat burdensome, but I think if we design the meeting such that part of it is dedicated, and we would just set time limits, part of it dedicated to the complaint, part of it to the tobacco regulations.
Okay,
And
no,
at that-
my point was that bringing that up now was premature. Correct?
All right.
I
Then,
don't think it's premature to bring it up right now, Mark, only because the board has to be aware that a complaint was filed and it's going to be referred to me for answer, which is a formal document and action taken in the Superior Court to deal with it. In terms of dealing with the actual subject matter, that can be dealt with at a later meeting, such as the one on September 30th to discuss the merits. This is only just giving notification to the board that a complaint for judicial review has been filed and that it's going to be referred to town council for answer. Nothing more.
Right, but Dr. Rose just said that there would be a public hearing matter.
it is, yes. It's a quasi, now, when we get to that point, I will explain my reasoning for that. So please, let's just wait for the complaint part until we get to that part of the agenda. But meanwhile, how about this? If we set times, and I know if Laura can't make it until 4:35. We do not need a quorum. We do need a quorum, but we do not need all three of us. Laura, would you mind if we started with the tobacco hearing at 4 o'clock and then have the complaint hearing at 4:45 or 5 o'clock? Would that, you could come in later to the meeting?
I guess the question would be if what the validity of my vote if I'm not hearing all testimony by the public.
That's fair enough. So, all right, let's start at 4:30. I mean, yeah, not to be stupid, but yeah, we don't need your vote, but Pete and I both vote, but yes, we want your vote. So thank you. Okay. So we will schedule a meeting for September 30 at 4:30. We will begin with the tobacco regulation rehearing, and then we will move to other business, which we will discuss later. I don't believe we need a motion to schedule a meeting. So I will, but we will note that at the end when we discuss when our next monthly meeting is. Okay. And then the third part of this section, I sometimes feel as though communication among town employees, other town agencies, and the board it's been difficult. It's been difficult for a while, and I mean, just part of it, as Pete noted, that Code Enforcement Officer Mark Blaisdell has not been at a couple of recent meetings, which makes it difficult. Our last meeting, I mean, half the agenda was based on material that Mark Blaisdell was supposed to bring to the meeting. And so it just feels as though we don't seem to be able to communicate effectively and get the information that we need in order to make appropriate decisions. There were other issues, particularly over email, where I felt as though I was being told to do this or to do that, or that I couldn't do this, I couldn't do that, and it was just not appropriate. And I'd just like to find some way that we could, I want to say, gain the respect I think we deserve, because it makes it so much easier, I feel, if we are have an open line of communication with other members of our community. Any thoughts from either of you two?
I guess are you referring to, I guess, can you give an example of where the communication breakdown is and with whom? I guess I'm a little confused.
Well, for instance, I mean, early on, I started bringing up a budget matter. Jerry Garner, basically got very agitated and said that he controlled the Board of Health budget, which isn't true. I mean, it is our budget, and it's not his money to spend. It's ours. We need to approve expenditures, particularly larger particularly the larger, I'm not talking about stamps and envelopes for Pam, but large budget items we do need to approve. So I was really surprised that he sat there and said that it's his budget, which it isn't. It's our budget. And we're the ones who developed the budget, and I understand we're not in a vacuum.
Yes, David, I think a lot of that, what you're talking about is, it was a previous administrator and previous staff when we first came on the board. And I think things were done differently then than they are now. And I think it's more to the book now. So I think it's some adjustment on our part, to work with the new staff members. I think that's my opinion.
Okay. Well, Mark is raising his hand. Mark?
So I think if we're going to comment about Commissioner Gardner, that we should have him here at the meeting. So if you want to agenda this or postpone this until maybe the next meeting so that he can give his input on why he administers the budget.
I agree with you. Yeah, that's fine. So, okay, well, maybe I will just let this, listen to Pete and feel that we just need to step back and make sure that we are hearing each other. And so with that, I will, let's just move along. So the next order of business is public comment. Does anyone from the public have a comment he or she would like to make?
I do.
Okay, again, as I said, please keep it brief. Do not, and keep it away from the contents of the complaint. So thank you. Go ahead.
I just want to ask, is the board opening this meeting to public comment, the whole meeting?
No, there's a specific period where the public may comment.
Okay, I'm referring to Mark Blaisdell. Keep interjecting. Do we all have that ability?
He's part of the health department, so he has standing in this meeting, and so he's not part of the public. He's part of us.
I'd like to see. I'd like to ask.
But again, this is not part of the complaint. But oh yeah, that's right. But yes, you do have a right to ask that question. But the answer is, Mark Blaisdell has every right to speak in our meetings because that is part of his job description. It says specifically that he is to participate at Board of Health meetings.
I'd like to ask Attorney St. John if that's the case, if he is part of the board.
He's not a member of the board, but David Rhodes said it exactly right. I think that, Mark Blaisdell is looked to by the board for advice with regard to issues that the board deals with. So he's not on the same footing as you are. He's an advisor to the board. I stand in the same position. I'm here to assist the board from a legal standpoint because there are obviously some sticky issues that the board is dealing with here. So I've been asked to be involved from that perspective. And on the same hand, Mark has to deal with some of the thorny issues that the Board of Health has to deal with. So it's different from you. You're given an opportunity, as Mr. Rhodes said, during public comment to offer public comment. And that is very typical for any board meeting. anywhere throughout the Commonwealth of Massachusetts. So it's, to me, it's two different things.
Okay, thank you.
Thank you very much. We do not have a public hearing tonight. And so I will move on to the code enforcement officer's report. I think I have 4 items under this. Would like to have Mark's input on the status of reopening restaurants and public spaces around town. How is it going?
So with the state of emergency, we had put into place some additional protocols for restaurants that wanted to open while serving outside. So there were special protocols that were put into place, required approval from myself, the fire department, the police department, and the building commissioner. So each of those eating establishments opened without incident. We did have some restaurants that had not opened, and they waited to further progression. We've had other events open under the progression of the state of emergency. We've had sporting events, organized sporting events, open again without incident. We've had a few occasions where complaints were made about certain enterprises. We would go out, we would investigate. Some required orders to be issued, some required tickets to be issued. We kept our operations full-time. Other municipalities didn't. So we continued to do restaurant inspections. We continued to do housing inspections, nuisances, and whatnot. So we maintained our operations full service. That's about it.
Well, thank you. I mean, obviously I've been out and about, and things seem to be going well. So I totally appreciate, I think, speak for the board unless they want to say themselves, but I really appreciate that things have been reopening smoothly, and thank you for that. You had asked about the catering, which was not a formal item on the Full Circle online permit menu. Can you fill us in on what we should do?
Okay, so at one point it was on the full circuit permit menu. It was taken off shortly after I got here because they were given an updated fee list that did not have catering on the list, our fee schedule. So what I wanted to do was have our fee schedule, which was revised March of 2019, I would like to have that amended to have catering put back onto the fee schedule, and the cost of that was and should continue to be $100.
And I believe for them to change their software package, it does entail a fee.
No,
It does not.
No.
Yeah, I do remember it seemed that the changeover to the Full Circle, the categories changed from what they were before Full Circle with our permit. I still have not gotten a good handle on it, but so what do we need to do in order to get catering added to the menu?
It's already been done. I just need
Okay.
your approval for the fee schedule to be amended,
Okay,
for catering to be put back on the fee schedule, and its fee structure to be fixed $100.
so are you looking, I think I had actually redesigned the fee schedule a while. It's been a while, definitely pre-COVID. Are you looking at the one that it's an Excel spreadsheet that I maybe PDF'd on the town website?
I'm looking at the one that I pulled off the town website, which is the one that Full Circle had in their possession. So like I said, its last revision was March of 2019.
Yeah, I think that's probably when I did, yes. That's
Okay.
probably when I did it, okay. So then, well, you and I communicate later, but I think what we need to do is have a motion to approve the $100 fee for catering as part of our permitting menu. Do I have such a motion? Anybody?
So moved.
Okay. Second, David, I just want to look at it first before, so I'm trying to pull it up on the website now.
Yeah, I thought, I mean,
I
I know we
remember, I do remember looking at this a couple times, but I just want to refresh my memory on what this looks like.
I mean, I remember there's like tattoo parlors. I think they're a yearly permit, but the tattoo artist is every other year. They need to be certified, and I remember just trying to put in all the details there, and I don't remember catering.
Yeah, there's food establishment, which would be $100. A mobile vendor, $25 for up to 3 days, and then a seasonal is $50. So I assume that would be a year. Mark, is that right?
It
Well,
would be,
those are the food trucks. That would cover the whole summer, like Aggie Fair and Hijinks and.
Right, but seasonal, would it be for a whole year, or would it just be a summer or a winter or whatever? I guess.
It would be for the whole year, but it basically means spring to fall. I think.
no,
But-
for catering? Are we talking
No,
catering?
No,
that's
I'm
the
asking about
temporary.
I'm just comparing to other fees under the food. So, mobile vendor it says seasonal and it's $50. So I guess my question, would that be, January to December, or is it just, as David said, like a summer thing?
It would depend on the season, because they would have to specify that date range,
Okay.
okay? And so, Laura, if you want to go to, because I sent you all the email that had the
Okay.
schedule attached to it, on July 14th. So, oh yeah,
My question too is our previous one prior to the 19th, which I guess would have been January
Okay,
2017, that had catering on there and the fee was $100. Is that correct?
yeah, that's, yes.
yes.
Okay. Okay, that's all I have. Thank you.
Okay.
So we have a motion on the table to resume catering as a permit option at a $100 annual fee. Pete, how do you vote?
Yes.
Laura?
Yes,
And Dave? Yes. So the motion passes unanimously. Thank you, Mark, for bringing that to our attention. And again, I will confer with you regarding updating because, like I said, I think there may be discrepancies between my fee schedule and the current full circle. So again, thank you.
All right, and I had also asked Pam to see if she can retrieve any template that she had, so maybe the three of us could meet.
Right, yes, I did it in Excel, but then I PDF'd it for the website. So I think Pam might have the Excel, but I can dig that up. It is ancient. I mean, it's ancient history. It's pre-COVID, so but I will dig that up. And I did put on here for the tobacco regulation, so maybe now is a good time to deal about the blunt wraps, cigars. Could you let us know what your concerns are and how you think we could address the blunt wraps and the cigars as we go forward with our tobacco regulations?
So I had sent the three of you email July 21st, which was forwarded from MHOA regarding recommendations that local boards of health update their definitions for blunt wraps as well as cigars. So what I wanted to see happen was that we update our blunt wrap and cigar definitions within our regulations before the public hearing. So that when you vote to approve your regulations, you have consistent definitions throughout the Commonwealth between municipalities.
Well, there are two ways we could look at this because we removed, actually, on your suggestion, we removed the blunt wrap restriction from our regulations to begin with, and so it was pointed out. I think Laura, and I don't know if I can speak about our last meeting, but that the why have blunt wraps as a definition when they're not disallowed. So that's more of a question, which now that we have a chance to go either direction, we could just either strike the blunt wraps from the list of definitions or update it. Pete, Laura, you have thoughts on?
I don't know. I mean, it goes back to the point of should it even be in there if it's not being regulated, and I don't know. I'm fine. I think I was just fine either way with it. So, but I if we're going to leave it in there, it probably should be the most up-to-date definition.
Okay, so whereas we were no longer going to ban blunt wraps within the town of Adams, your draft regulation does contain the blunt wrap definition.
Definition, correct.
So, as I stated, to be consistent with the definitions between municipalities throughout the Commonwealth, they provided us an example. They provided every municipality with this same example of a blunt wrap definition as well as a cigar definition. So it would be my recommendation to the board to improve upon our definitions by adopting the consistent language which will be used by other municipalities.
I think that's probably good advice, as long as we're going to change. I mean, so,
Yeah, if we're gonna leave in the definition of blunt wrap, but it's gonna no longer be used in the whole document, but we're gonna leave that definition in, I agree, it should be the most up-to-date one. Obviously, cigar, that one, we use that, so that one should be changed.
and so, so Mark, you said the recommendation comes from, is it from MHOA or?
Yes, it's the July 20th email from Sarah McColgan.
Yeah,
And I forwarded this email to you on to you specifically, Dr. Rhodes, on July 20th.
right. No, I
Okay.
remember.
And then again on the 21st.
Okay. So do I have a motion to update the definitions of blunt wraps and cigars to conform with the recommendations of the Massachusetts Health Officers Association?
So moved.
Second,
Any further discussion?
no.
Thank you. So I'll call for a vote on updating those two definitions. So that's going to be Pete, how say you?
Yes.
Laura
Yes,
and Dave? Yes, I also say yes. So the motion passes. So I will take care of updating the regulation for posting. That does bring me to the question. We actually do not need a publication of a public notice in the Eagle. It's not legally required, but it is considered best practice. So I believe that I will write a notice for the Eagle and have Haley post this revised regulation. So I do not think I need to mention in the notice about the changed definitions. I will just say that these are the current draft regulations, which, by the way, will not include what we decided on the last meeting. Does that make sense?
Yeah.
Yeah, okay. So, okay, then moving on to the last, under this section, the Dollar General plastic bags. Mark pointed out that the bags that Dollar General are giving out are plastic, and they possibly conform to our regulations, but they do not conform to stricter plastic bag ban regulations. I looked up the regulations that we passed a couple years ago and what got put into town code, and our code is actually fairly vague. It says the only thing they're banning are, thin film single use that are 2.5 mils or less thick. And I'm not a good judge of mills, but I believe the Dollar General plastic bags are at least 2.5 mil. Am I correct, Mark?
Actually, it's not stated, but by the way our regulation and bylaw are written, this would conform. However, as I explained, there are two other jurisdictions in Berkshire County that I think that we should look at what they have for their definitions and merge theirs with ours and come up with something that will prevent the use of these types of bags that could end up in the landfill or into bodies of water and whatnot. So that's my suggestion is that that I'll get to the other board members those other two jurisdictions' definitions, and we can compare the three and then come up with a new definition.
Right, because I remember that I think Williamstown actually has a number on how many reuses the bag
Correct.
take.
Yes,
And also
exactly.
the stitching, whether it's stitching.
Yep, so I didn't want to mention the municipality itself because this will have to go before town meeting. So this will give us a time to put it together and to have a discussion among the board and maybe among the public before not the upcoming town meeting, but the very next one.
Right, exactly. Because I did have a sense that we will probably have a special town meeting somewhat later before the next annual.
That is also my understanding.
Yeah. All right, good. Thank you. So you circulate that, and so at our next monthly meeting, we can pick and choose which aspects of the definition to put to request that town vote on for the updating the plastic bag. So thank you.
Okay, thank you.
And so, all right. Do you have anything further, Mark, before I move on to the business?
No, sir, not at this time.
Okay, thank you. Again, it's been busy since last month, so I have not had the opportunity to give all our regulations my sufficient attention. And the COVID-19 update, I guess I should only say that Adams is now beginning to see a few cases. It is kind of unsettling because we were, September? We were like 3 months without a case, and it's kind of unclear, the sporadic, and we don't have a good sense of whether they're travel related or what. So it's kind of hard to get to know how to respond other than just to continue promoting, safety, social distancing, mask wearing, no large gatherings, and so on and so forth. Certainly the large gatherings has impacted us. I learned today that there are probably 3 cases in Berkshire County that could be traced to the Sturgis motorcycle rally in, I think it was South Dakota, which was definitely a super spreader event. And so it's definitely important to continue with the recommendations from the CDC and the Department of Public Health. Are there any further thoughts, Pete, Laura, Mark?
I just, looking at the data that was sent today from BMC, it was just interesting to see that graph that showed that the county is pretty close to, is starting to increase, and it's close to what it was around the July 4th holiday and that. So, you know, hopefully it doesn't continue to trend that way. But it's like you said, it's kind of scary to see that that's starting to trend back to what it was around the 4th of July.
You
Was
think
a
it's
little
holiday related, maybe
Yeah.
holiday?
Yeah, so it might be Memorial Day holiday spike, you know, I don't know. But I hope it starts going back down.
Right, right. And certainly this, you know, the schools are, you know, are doing well. Williamstown, MCLA, and at least the ones that I see, very limited. So that's great. Okay, moving on to new business. School reopening plans is huge among discussions. I think that you know, Mark has been in communication with the schools and their opening plans. Is there anything you can say there with regard to the 3 schools we have here in
Right.
Adams?
Right, so I did obtain plans from all 3 schools to have to present to the board for the first meeting in October. However, there have been numerous changes at the state level, EEC and DESE, sometimes as much as twice a week. So the most recent update that we got was on September 14th. So during that interim, I have not required the school to give me an updated plan because the protocols, the standards had kept changing from the state level, from DPH through EEC and DESE. So that would kill a lot of trees for them to have to keep sending me updated plans. It would be sometimes as much as twice a week. So we expect another revision, but the schools are, again, we have 3 separate schools. So they're each not doing their own thing, but trying to maintain continuity, because here in Adams, they still have to report any cases or any contact with our public health nurse. So there has to be continuity with these 3 separate school systems to our public health nurse.
So Gina Armstrong had emailed me on my request today what Pittsfield has for their management of students and staff who become symptomatic at school. And would that be worthwhile for me to send that to modify it for Adams and send it to you and Nancy Slattery?
No, because we don't have one single school system. We have the Adams Cheshire Regional School District, we have Bart Charter, and then we have a Catholic parochial school.
Right. But, you know, this, what theirs is, what's
The
that?
continuity and consistency is going to come from EEC and DESE. So DPH is having them align their standards and guidance.
Mhm.
So what you may get from Pittsfield should be consistent with EEC and DESE. But I don't think that we should impose on these 3 separate school systems. They're not looking at each other's. They have to get approval from their school boards.
Right.
So I think we don't want to burden these enterprises with what somebody else might do. They're taking their guidance from the state and presenting it within, or discussing it within their houses, and then presenting to their boards for approval.
Yeah, I was just saying, it just seemed to be a nice compact. It does, reflect, as you say, DESE and EEC and DPH. But if the schools have their own, which is clear and satisfactory, then that would be suitable.
Right. I think that these superintendents would have reached out to people they trusted for advice, which may have included Pittsfield, but they have put forth a product for use within their venues. And I think we should accept it unless we see something outrageously wrong that needs to be corrected.
Right. And as you said, I think Nancy Slattery is in contact with all the school nurses.
Absolutely, she is.
Okay, it's just like to confirm that. So thank you. Moving on to flu clinics. I know this is a hot area that, and it's become challenging with of course, with the COVID restrictions. And as far as I know, I know the pharmacies have gotten flu vaccine, but schools, it's been a little bit slower for them to receive vaccine for the students. And I know I talked to Nancy Slattery, and the VNA actually does not, they will run flu clinics, but not for children. They don't do pediatrics. So the assistance with the schools would either have to come from somewhere else, or you were thinking that we could assist in some way or other. Do you have any further suggestions on such assistance?
To Mark?
Yes.
Okay, yeah. So if all three school nurses are inviting for a flu clinic for the students, parents, and staff, however, if we use the public services of public health nurses or the Berkshire County Boards of Health Association or the public funds for the vaccine, then it cannot be restrictive to the public. However, if you recall on last Friday's DPH call, someone also addressed that, because there are certain elements of the population who would not be permitted to be on school grounds.
Right.
So we're waiting for an opinion on that, maybe this coming Friday. But again, we do have a pharmacy that holds their flu clinics, and also in the surrounding communities. The school nurses would have to have assistance, and we could gather that assistance from BCC, from the nursing program there, possibly even if we reached out to McCann, because they have at one point at least, they had a nursing program there. So this is still work in progress. There's a shortage of vaccines, and there's also a shortage of needles for the syringes. So we still have some time to do some networking on this.
The state deadline, I think, is December 31st. Obviously, we'd like to beat that.
Obviously.
So yeah, okay. So you are in contact, and yeah. So thank you for keeping on that, and let us know if there's anything we can do to facilitate or funding needs for staffing or whatever.
Okay, I appreciate it.
Thank you. And Pete, you're on. You wanted to add a,
Oh, yes. Yeah, so I circulated a link to mental health. Trying to pull it up here. Mental Health America. That's just kind of a informational step-by-step thing for mental health with the whole pandemic going on. It was something that I came across when I was looking, prepping for my classes and I'm presenting this to my students. So I thought it might be helpful to have this link on our website, for the public as well, just to increase the awareness of it. So I sent that link for you and Laura to review and see if this would be worthy of putting the link on our website under the COVID thing or under mental health or however we want to put it on the website. And if you guys think it's warranted, then I could send that to Haley and have her put that up there. So.
yeah, in fact, I don't think this requires a vote because it's promoting public health and we don't need, it's basically providing information to the public, which I believe we're allowed to do without a vote. And so I would say, yes, please. I thought the information was very useful.
Yeah, I think it's one of those things where we're during this pandemic, we're constantly thinking about our physical health, and we sometimes don't think about the mental health aspect of it, of being
Right.
locked up almost and not being able to contact with others and things like that. So I just, wanted to have that out there to raise awareness, I guess. So.
Yes, please. Thank you for thinking of that, and just send it on to Haley. And
Okay. Thank you.
So the next item under new business is the fact that we received a complaint for judicial review, and by law we have to respond. This is from Superior Court, and we have to respond within 20 days with a response. And Attorney St. John has graciously offered to forward our response, but we need to develop one in an open meeting where we can actually look at the nature of the nature of the complaint and how we want to proceed. And so I'm proposing that we use September 30th to hold a public hearing on the matter. So it will be similar to the public hearing we had on tobacco, that we will open the meeting for those, what do I say here? So to address the complaint, and the hearing will be limited to those withstanding in the case, the complainant, representative, our code enforcement people, our town administrator, Attorney St. John, and possible experts that might be designated. And so I would open the public hearing. It would be quasi-judicial. We would look at all the aspects, and then close down the public hearing so that three of us could deliberate and develop our response.
David, can I just interject here, please?
Yes, please.
The purpose tonight was simply to inform the board that there was a complaint for judicial review of the board's decision back in June with respect to Ms. Foster's appeal of the code enforcement's orders. And your hearing on September 30th is just simply to discuss the complaint and what needs to be done. The action that needs to be done is done in the Superior Court, not in the Board of Health. The Board of Health's involvement in this is over with as far as at this level. If the Board of Health is involved any further, it's simply through testifying in the court matter. So there's no need to be scheduling a public hearing and deliberating and taking votes on this. Your job is done. So it's a matter now where a Superior Court judge is going to conduct a review of what took place back in June and determine whether the board's decision back in June meets the legal requirements for a decision of that type. It's a hearing that's conducted under Chapter 30A of the general laws. So that's done by the Superior Court judge, not by your board. Okay?
Well, so we do have to create a written response within 20 days. And so
I create a written response. I do something that's called an answer. And I just simply give an answer to the court, an answer which responds to the allegations made in the complaint for judicial review. Then it's up to the Superior Court at a later date to conduct a hearing to determine whether the board's decision stands or whether Ms. Foster's position stands. And that's something that the board doesn't have any further involvement in unless you're called as witnesses or you're going to produce documents. I mean, typically what's done is you produce documents. This is what I was going to discuss with you on the 30th anyways. You know, the point of that is just a discussion as to what the board's going to be doing in this further. And it's
Okay.
basically helping out.
So
Okay?
basically, we would vote on approving your answer.
Well, I don't think you need to vote to approve anything at all. I have to do what I typically do for these kind of cases. And, you know, I'll forward to the board a copy of the answer at the appropriate time. But it's just simply an answer to the complaint, which presents it to the court. It's nothing where the board has to take a vote on anything. It's just simply a discussion of how it's going to be handled, what would be expected out of the board going forward. That's what we're going to discuss on the 30th. I don't want to talk about it right now because this was a late posted agenda item. I simply wanted to alert the board as to what's going on. And on the 30th, when you schedule this, we'll just talk about what we need to do going forward, what we need to gather, what information we need to provide. Okay?
So there will be no public involvement.
No.
Okay.
It's not a matter that involves public involvement. I mean, public comment is going to be part of your meeting anyways, but it's just simply a matter that I just simply need to discuss with the board and say, look, this is what's going on. This is what I have to do. This is what I would like you to do, and provide me with, you know, these records, these documents, these recordings, this information from, you know, Mr. Blaisdell, this information from Mr. Garner. I mean, we'll talk about all that.
Do I see Mark raising his hand again a few minutes ago. So I'm sorry to cut you off, but Mark, did you have a question on this?
No, I was going to mention exactly what Attorney St. John mentioned.
Good, okay. So we sit tight. We have our meeting on the 30th. We will deal with the tobacco hearing straight away and then follow up with the complaint. And And that will be it. Is that okay.
Mhm.
So we will only have the one hearing.
Right.
Thank you. That simplifies my life for sure. Maybe in the short term. So, okay. Then that's it for new business. I think the only other thing I had, well, the two things I had to mention was I did send around the link about the Attorney General's course or webinar on open meeting, and I think the next one might be the 23rd at 6 o'clock. So it's nice that each month I think they have one during the day and one in the evening. So I strongly encourage you to sign up for one in the future, in the near future. And they are topical because the one I took did deal with COVID, and a number of questions answered around how do we deal. So it was very useful. And then the tabletop exercise on flu clinic, I have signed up for that. I suspect the two of you might be tied up during the day because it's Friday at 9:30 or 10:30, I think. Tabletop exercise on a flu clinic. So I don't know if Mark is going to join that one, but I certainly will be joining that, and I will let you know how that turns out at our next regular meeting. So other than that, anything else from anybody else? Well then, so we have the September 30th meeting at 4:30, and I will.
David, sorry, are we doing for good of the order? And
Oh, I'm sorry. I just jumped right over that. So you have something?
I do. I just want to, since Mark is here, I want to thank him for his hard work over the last few months through this pandemic. I know he's working his tail off and doing a good job. And Mark, I want to thank you for helping us out, helping the town of Adams out through that. And thanks for being here tonight too. Appreciate it.
Welcome.
Thank you.
Yeah, here. I think we all agree on that.
And that's all,
Laura?
David.
Okay, so then on to scheduling the next regular meeting, and I've just put down here October 7th as the next first Wednesday. Any thoughts?
Yeah, I already have that in my schedule, so that would definitely work for me.
Okay. So
I think I'm going to be free, but I guess I'm just, what do we have to discuss at that point? I'm just, again, I have concerns that, we haven't had a staff member. There's things that have been on the agenda for a while that we just aren't getting to. Should we take them off? We're going to meet just a few days before that. Is it necessary to have a meeting?
well, I think in terms of some of these regulations that Mark, the plastic bag, and that I guess that's not that critical, depending on when we do have the next special town meeting. I just kind of feel like it's important for us to keep in touch on things. If you would like to move it to later in the month, Would that feel better?
I don't know if anything's going to feel better. I'm just making that point that, I don't like meeting just to meet. If we can meet and get stuff done, I'm all for it. So, but I'm also leery that we're being blamed for stuff, and we don't have a staff member to help us with some of the logistics. So I don't know what's going on with that. I'm not pointing fingers. I'm just trying to be cautious, I guess.
Right. We would have time. Can we just
Pencil it
possibly?
in, and
What's that?
then can we pencil it in and then decide on the 30th if we really need it?
I would be, yeah, because it'll give us 2 weeks to see if something is coming up that we need. So, okay, I'd be good with that.
Okay.
So the 30th and question mark on the 7th. All right. Do I have a motion to adjourn?
So moved.
Second.
Any discussion?
No.
So we will take the vote. Pete,
Yes.
Laura,
Yes.
and Dave, yes. So I'm looking at my clock here at 5:29 on the 16th of September. This Board of Health meeting is hereby adjourned. Thank you all.
Thank you.
Thanks. Oops.